Today we're going to talk about hypertension. So first of all, why is hypertension very important? Hypertension is actually one of the most common diseases worldwide. According to the WHO statistics, 1 out of every 4 men and 1 out of every 5 women suffers from hypertension. And the problem is that less than 1/5 of everyone with hypertension actually control their disease. So the rest remains uncontrolled, and this is very risky. So hypertension affects two main things, the heart and the blood vessels. First of all, the heart. The heart is affected by the high blood pressure because it needs to exert more and more effort in order to perform properly. And the higher the pressure of the blood pumped by the heart, the more the vessel walls will get affected. And as time passes, this leads to the thickening of the walls of the vessels and also the appearance of atherosclerosis. And also, as time goes on, this tires the heart more and more till it reaches to the point of cardiac arrest or heart failure. Now, the blood clots or the atherosclerosis that is formed, it can reach the brain through the blood vessels and lead to a stroke, and also it affects the kidney function and can lead to kidney failure. Now we can see that hypertension is very dangerous and it needs to be controlled. But first of all, we have to know what are the risk factors for hypertension. There are two types of risk factors, controllable and uncontrollable factors, because there's hereditary factors. For example, if there is someone in your family that has hypertension, this increases the risk of you having hypertension. Or if you are more than 65 years old, this increases the risk of you having hypertension. So what about the controllable factors? These include having an unhealthy lifestyle, so eating unhealthy foods, not exercising, so a sedentary lifestyle, smoking, alcohol consumption, with food also consuming a lot of salt. Salt is very important as a risk factor for hypertension. Being overweight is also very risky. Now, all of these are controllable factors, so we can modify these things, and this actually decreases our risk for having hypertension tremendously. Now that we know all of that, what is the normal blood pressure? The normal blood pressure is 120/80, or a little bit less than that. Now, what does it mean? What are those numbers? 120 and 80 are measured in millimeter mercury. So when we put the cuff in order to measure the blood pressure, the cuff presses on the arteries of the arm, the brachial arteries, for example, and it measures the pressure by which the blood passes through that artery. So when the heart contracts, it pumps the blood with a very high pressure, and this pressure is recorded as the mercury rises up in the bar and it reaches to the value of 120 millimeters. And then when the heart muscle relaxes, that pressure drops down till 80. And then we cannot hear the heart beating anymore. Now, there are degrees of elevated blood pressure. So a slightly elevated blood pressure is between 120 and 130, and 80 and 85. First degree hypertension, so which is officially hypertension, is between 130 and 140, and 85 and 90. And second degree hypertension, which is more risky, is more than 140 or more than 90. Now, if someone has a blood pressure more than 180/100 or 110, this is very risky, and they should check it immediately as an emergency in order to see what is the actual cause of this very elevated blood pressure. So this is it for today. Don't forget to like, share, and subscribe, and I will see you next time.